got a strong heartbeat.
Do I?
Yeah. Okay. And then if I could just have you lift up your shirt a little bit for me. And then this is your tricuspid, and it's the fourth intercostal space, mid-clavicular line. Okay, and I'm just going to listen to your mitral, which is the fifth intercostal space left of the sternum. Okay, other side. Okay, and then I'm just going to listen for 1 full minute, and this is your apical pulse, okay?
Alright.
You doing okay? You comfortable?
Yep.
Okay. So that's your most accurate, like, pulse or heart rate. And for that one, I got 79.
Okay.
So it's around the same, as when I took your vitals earlier.
Yep.
So now I'm just going to take a look at your abdomen, okay?
Okay.
So first, I'm going to inspect
Perfect.
as best as I can from down here. Okay, and I'm looking for, like, any lesions or adipose tissue being unequally distributed.
Okay.
And I don't see any of that, so I think we're okay. And then I'm just going to take a listen to the arteries that you have, like, in your abdomen, if that's okay. Well, first I'm going to listen for gurgles.
Okay.
I'm going to start with the right lower quadrant. Okay, I heard 5 gurgles. Did you eat today?
Yep, I just ate.
Five gurgles. And then more than 5 gurgles there.
Yeah.
And then I'm just going to listen for any bruise or whooshing sounds that you would have. And I didn't hear any heart murmurs up there either. So I'm just going to check here. I'm going to start with your aortic, with the bell. And then your renal on the right. Renal on the left. And then iliac on the right. Iliac on the left. Okay. And then you do have arteries like right here. It's called the femoral arteries. Can I just take a listen?
Yep.
Okay, other side. Okay, all good. And then I am going to...
Oh, sorry. I'm just cold.
It's okay. I'm going to percuss your abdomen, okay? Oh, sorry.
Oh, I'm sorry.
Stepping on you. Okay. And just let me know, like, if you feel any pain or anything.
Okay.
Too. So I would be here listening for tympani over everything except for, like, right here, which is your liver, which is dull.
Okay.
Sounds good to me. And then I'm just going to lightly palpate your abdomen, okay?
Okay.
So just let me know if there's any pain or tenderness. I see you have a tattoo here. Does that give you any issues?
Nope, I feel pretty well.
Okay. And I'm just gonna, like, push a little bit deeper.
Okay.
Just let me know if there's any pain. Okay. I think we're all good there. I'm going to take a look. No, I'm not. I'm going to do your legs next.
Okay.
Are you cold? Are you
Yeah,
all set?
it's
Okay.
just cold in here.
I'm sweating. So I'm just going to take a look at your legs the same way that I did with your arms.
Okay.
I'm just checking to make sure that they're all, for you, cold throughout.
Yeah.
And then your muscle tones. And then check for edema, which you don't have any. And then you also do have, like, pulses or whatever you want to call them, in your legs. So I'm just going to check your knees here and then your feet, okay? And so this is your popliteal. And I'm just checking for symmetry. They're both symmetrical. I'll do this. And this is your posterior tibialis. And then your dorsalis pedis. That sounds good to me. And I'm looking for something. Just 1 second. I think my photographer might be sitting on it, maybe. Right here. Sorry, photographer. I'm just going to put this on your leg and you tell me where it is, okay? And if it's sharp or dull. So this is what sharp feels like. Okay. And this is dull. Okay. So you can close your eyes for me. And then just let me know where it is and what it is.
Double right thigh. Sharp left thigh. Double left shin. Sharp right shin. Sharp left top of the foot. Sharp right top of the foot. Dull bottom of the left foot. Dull bottom of the right foot.
You got all of them right, so that's 8 out of 8. Just checking your like sensation or
I was
anything.
not very confident.
Just checking like your sensation in your legs. Some patients that have like diabetic neuropathy or anything probably wouldn't feel that as good as you did.
Okay.
Okay, so I think I'm gonna check my sheet one more time.
Alright.
Before I have you get up for me, okay?
Perfect.
With this one. Okay. I'm just gonna listen really quick for the bruise that I checked in your abdomen and stuff.
Okay.
Oh, I think we're all good. So I'm having you sit here in front of me. Can you just take your hands from me and then go like this back and forth as fast as you can. Okay. And then okay. So that's just testing your cerebellum function.
Okay.
And then can you do this motion? Okay. So I think that's with your arms. It's just checking your range of motion and stuff.
Okay.
So I'm gonna move to your legs really quick. Can you swing your legs in and out for me? Okay. And then, okay, back to your hands really quick.
Okay.
Can you like push against me whichever way? And then up it. Okay. And then I'm gonna do the same thing with your legs.
Okay.
And then feet.
Kind of.
Your feet are cold.
I know.
Is that good for you?
Yeah, it's normal.
Normal.
It's cold in here.
Oh, okay.
Cervical flexion. So I'm going to go ahead and line this up here with your chin. And what I want you to do is I want you to go ahead and bring your chin down to your chest. Okay. Great job. We got about 46 degrees. Okay, and now for extension, go ahead and just go back right back to normal there. Again, lined up with your chin there. And what I want you to do is I want you to bring your head back as if you're looking up at the sky. And again, we're going to go ahead and that's about 44 degrees and 45 is normal. So I'm just going to see if I can get just a little bit more. Okay, fantastic. So that was cervical flexion and extension. Next, I'm going to do lateral flexion. So I'm going to find my patient's spinous process. There we go. the spinous process of C7, and I'm gonna go ahead and line up the stationary arm with my patient's shoulder. Okay, so go ahead and bring your right ear to your right shoulder. Okay, so we got about 42. I'm just gonna see if I can take you just a little more passively. Fantastic, okay. Now I'm gonna go ahead and do the same on the left side. So find her C7 again. Stationary arm out to the side. I'm gonna start at a 90-degree angle, but technically starting at 0. So what I want you to do is go ahead and bring your left ear to your left shoulder. Okay, and 45 degrees, great. So again, that was cervical lateral flexion on both sides. Now what I'm gonna do is test my patient's cervical rotation. So I'm going to have the stationary arm out toward the back and my movement arm out toward the front, lined up with her nose. So I just wanna make sure I'm in a position where I can line it up with her nose. So I've got the fulcrum at the top of the head. Okay, so now what I want you to do is go ahead and turn your chin over to your right shoulder. Okay, so we've got about 41 degrees. I'm just gonna see if I can't bring you a little bit further. Fantastic. Okay, now for the other side. Again, lining up with the nose. Go ahead and rotate over to your other shoulder. And great, we've got about 49 degrees of rotation to her left. So this is goniometry of the neck. Now I'm doing goniometry of the shoulder. So first we're going to do shoulder flexion. I'm gonna put my fulcrum on the tip of her shoulder here, and I've got the stationary arm lined up with her body. So what I want you to do is I want you to bring your hand up in front of you and reach toward the sky. Go ahead. Okay, and my patient's reaching about 169. Great. Okay, now come back down, and I'm going to do the same thing for shoulder extension. And what I want you to do is just reach your arm back behind you, okay? Whenever you're ready. Great, okay, and we are getting 70 on shoulder extension. Okay, now we're going to do shoulder abduction. So I'm gonna put my fulcrum on the back of her shoulder here, and I've got the stationary arm lined up with the body. And what I want you to do is I want you to bring your arm out to the side, reach up toward the sky as high as you can whenever you're ready. Fantastic, okay. And up there, we're reaching 168. Great job. Okay, now we're going to do shoulder external and internal rotation. So first I'll do external rotation. What I want you to do is I want you to bring your arm here to 90 degrees and 90 degrees of elbow flexion. And I'm gonna line my fulcrum up here with the tip of her elbow. And what I want you to do from this position is I want you to bring your hand, rotate your hand up toward the sky, just like that. I'm actually gonna start, sorry, my apologies. I have my stationary arm lined up with her forearm. And again, I'm gonna have you rotate your hand up toward the ceiling whenever you're ready. Okay, and we're getting 85 for external rotation. And for this one, what I'm gonna have you do is rotate your hand down toward the floor whenever you're ready. And for this one, I'm getting 66. So I'm going to go ahead and see if I can just bring you a little bit further. Great. Okay. So that was shoulder external rotation and internal rotation. And lastly, what I'm going to do is horizontal abduction and adduction. So we'll do horizontal adduction first. So I'm going to have you bring your arm out here. I'm going to place my fulcrum up on the tip of her shoulder. Stationary arm is parallel in line with her body. And what I'm going to have you do is I'm going to have you bring your arm out in front of you, keeping it straight and as far over as you can bring it, okay? Okay, so my patient's able to get 126 for horizontal adduction. I'm going to see if I can push you a little bit further. Okay, now that's getting us to about 130. Now, similar starting position for horizontal abduction. I'm going to have my patient with her arm out here. I'm going to stand in front of her so I'm not in the way of her arm. Fulcrum up on the tip of the shoulder, stationary arm in line with the body. For this one, what I'm going to have you do is from here, I'm going to have you reach backward, keeping your arm at the same level. Go ahead whenever you're ready. Okay, and my patient is reaching 44 degrees of horizontal abduction. And this is goniometry of the shoulder. Now I'm going to do range of motion measurements with the goniometer for the elbow. So for the elbow we have extension and flexion. So what I'm going to do is I'm going to line up my axis with my patient's olecranon. Okay, now I'm going to and I have my stationary arm in line with her humerus, your upper arm. So I'm going to start, we're going to start in as extended as you can. There we go. Okay, so we're at 0 for extension, which is great. And now what I want you to do is I want you to bring your hand to your mouth as far as you can, whenever you're ready. Okay, and my patient is getting to
1. All right, so first I'm going to listen right here. This is going to be your aortic point, pulmonic, Erb's point, tricuspid, apical point. I'm going to listen here for 1 minute. I'm going to turn it over to listen to the bell to listen to heart murmurs. So with the, also what I'm going to check for is, may I check your arms here? Just hold them out for me. Actually flip them over, sorry. So what I'm checking for there is pitting edema. You don't have any edema. I'm checking for capillary refill. Capillary refill is less than 2 seconds on each of your fingers. That means you have good circulation to your fingers. I'm also going to check your legs for edema and capillary refill. So, all right, there's no edema. And if your feet were out, I'd check your toes, each one of them. Those can also be checked for capillary refill, but you're good within the expected range. I'm going to palpate your radial pulse. So radial pulse, it is a 2+ on each side. I can also check your brachial pulse, your apical pulse, your carotid arteries, only one at a time, not bilaterally. Your dorsalis pedis pulse is 2+. Your tibialis posterior. Tibialis posterior pulse is bilateral. I can check your popliteal and your femoral, all for pulses, and they should be the same. Just after a workout, you probably be a 3+, maybe a 4+. After cardio, you probably be 4+. That just means it's beating really hard.
you know we don't do cardio.
Yeah, we don't do cardio. We're powerlifters. Let's see. So I got all the heart stuff. Now I'm going to listen to your lungs. So with your lung sounds, I'll wait till you finish drinking.
Sorry, go ahead.
Because I'll listen to those sounds later. So with your lung sounds, I'm going to check 4 spots on your chest, 1 on each side, and then 4 on the back. After I untwist my stethoscope. So with the diaphragm, each time my stethoscope touches you, I want you to take a deep breath for me and release it. All right, now grab your left shoulder with your right hand. Awesome. And the other side. Thank you. And same on the back. Excellent. So all your respiration is even and unlabored. It is also eunypnic, which just means it's within normal range. So you're breathing between 12 and 20 respirations per minute. Let's see. So after respiratory, the next part is going to be your gastrointestinal system. So, of course, with all those touch points, with your lungs and with your heart, I would do that on bare skin in order to actually hear it better. So with your stomach sounds, I would have you laying back just because it's easier to access. Yeah, we don't want you to hurt yourself. So I will start in the lower right quadrant, which is going to be at the beginning of your large intestines. Here I would listen for up to 5 minutes, depending on when I hear your borborygmus. Borborygmus is just normal stomach sounds. So if you're 3 to 5 seconds, that means you have normal bowel movements currently, right? So do that in each segment. If it's less than 1 second, then